Welcome to the Healers Café, conversations on health and healing with Manon Bolliger, a retired and deregistered naturopathic physician with 30 plus years of experience. Here you will discover engaging and informative conversations between experienced healers, covering all aspects of healing, the personal journey, the journey of the practitioner, and the amazing possibilities for our own body and spirit.
So welcome to the Healers Café, and today I am with Kerry Madgwick, and she is a hypnonutritionist, and we haven't talked yet about what all that means, but I'm very excited to learn a little bit more about the subject, because since neurotransmitters are made in the gut and they inform a lot of our mental processes, then when we go in with hypnotherapy, you kind of have this combination of both that you need to function optimally. So I'm going to assume that you're going to expand on all this, and welcome to the podcast.
Thank you so much, Manon. Thank you so much for having me. I really appreciate having the opportunity to share and discuss, and as you said, for this information to get out there so that we can touch the people who need help, who need to be to understand how they can reach out. And I think for me, it's always giving people hope that there's a way to change the way they feel and that they can get better. So yeah.
So let me ask you, what was your own kind of path to get to this, to what you're doing now? How did it start for you, or your aha moment or awakening?
Okay, so it's been, shall we say, a long and checkered journey, as I think it is for most people. So my original challenges were, so I had endometriosis. I was diagnosed with endometriosis, and I was diagnosed with spastic colon. I guess I was fortunate in that I had a doctor who told me with my endometriosis that there was nothing they could do. They didn't know what caused it. They had no treatment. And she encouraged me to seek alternative or complementary therapies, which I didn't know that much about at the time. So I then, she had also given me a prescription for medication, but I had a friend who was a pharmacist, and she said to me, if I were you, I would not take this medication. So not knowing anything about the medical world at that point, or doctors or anything, I just thought, she's qualified, she knows what she's talking about. If she wouldn't do it, then I trust her and I won't do it. So I then kind of went down that path. And I think always, so growing up, I grew up on a farm, and I guess our methods of healing were always what we would now call natural and holistic, because we lived too far away from, kind of any Western medical help unless it was an emergency. So my mum was always good at finding alternative ways. So I kind of had that intuition that there was a different way and there was a different path for me to take. And I started doing my own research. I discovered a professor at a university who had written a book about gut health and how important gut health was. And there I went down the rabbit hole of gut health and how important it is. And by then healing my own gut, I solved my health issues. And then I think I came to the hypnotherapy after the nutrition and kind of the meditation, mindfulness, energy healing, all of those kind of things. And I believe we come to different paths when we're ready, and it wasn't something I would have been open to before. But I feel as I healed my gut, my mind also became more open to the possibilities. And those were kind of the missing pieces of the puzzle for me, that I realized actually, as you do, we heal holistically. We don't just heal a physical part or a mental part. We have to heal everything. So it's our environment, our relationships, it's the relationship we have with the food we eat, with the thoughts we think, and that's how kind of everything came together. And then I guess being a clinical nutritionist, I worked with my clients on their nutrition and realized actually how important the mindset was, that some people need the guidance from the mindset first. Some people need the physical healing first, but they all work together and interact beautifully together, as you know from everything that you do as well. So
yeah, no, very interesting. So give maybe an example of, again, this is spontaneous, so if you don't have one, we can go somewhere else with this. But like, you know, somebody who heals their gut, like you did yourself, that's how you started.
Yeah.
When you decided to do hypnotherapy, yes, it's an extra, and yes, it's the mind, but did you also find that it further impacted the gut?
Yes. So that's one of the reasons why I'm in the process of now training other hypnotherapists to take a gut health program into their practice, because it's one of the reasons why I introduced my hypnotherapy with my nutritional therapy. A lot of my clients come to me with gut issues, which I guess, you know, we generally tend to attract the people who've had the same challenges we've had, because we can speak about it from experience. So having seen clients with endometriosis, with PCOS, with IBS, and just working the hypnotherapy. So all my nutrition programs encompass hypnotherapy within those. And then it was understanding how well they worked together. So a lot of our communication, as you know, goes from the gut to the brain. The gut controls a lot. But if we can also then learn how we control our thoughts and the way we feed our minds together, then you really have as I always say, it's kind of like the missing piece of the puzzle, and you feel like, you know, you found the last piece of the jigsaw and it all clicks in together, and it makes a profound change. So that's why I've started helping other hypnotherapists to take this program into their practice, so they can help their clients on both the physical and the mental. You know, I think as we all know, it's the holistic, and the two work really well together. I'm not sure if you're aware, and I'm sure you are with all of your experience, but when you're actually a fetus, your gut cells and your brain cells are actually the same cells when they formulate in the fetus. So there is that intrinsic connection from, you know, even preconception, you know, that connection goes on. So working on both areas of the gut and the mind is, you know, has such a profound impact for people.
Mm-hmm. And can you address, you know, many times people can, if they learn to be a little more intuitive about the foods that work for their bodies and don't work for their bodies, which is all about listening, you know, to their body.
Yeah.
But there's also like unconscious, like saboteurs, behavior saboteurs, right? That make you want, or you could say it's physiological if you're going to have cells that crave sugar and you crave sugar. It's one thing, but could you expand on that, maybe with a case study, no names obviously, but like an example of how they go so well together and how one can reinforce the other? Like,
yes. So perfect. I've actually just I've recently worked with a lady who had so she struggles with ADHD, and so she was struggling with sugar cravings, and she said that she is a hypnotherapist as well, so she understood that connection, but just felt that she couldn't get on top of her sugar cravings. So once she went through the program, and I think for a lot of people, it's understanding that so with our microbiome, we have helpful and unhelpful bacteria, and we do need both, but it's the balance that we need. But the unhelpful bacteria feed off sugar, and they want to stay alive as much as we as humans want to stay alive. So they do drive the sugar, the cravings for the sugar. So sometimes people have cravings that they may not necessarily understand where they come from, and it could be the bacteria that are driving your brain. So for her, she didn't really have sugar cravings as such, but she found that she was always going to the higher sugar foods because it was being driven by the gut bacteria. So once we started to manage and rebalance her gut bacteria, then she basically said she's never had a time where she hasn't had those cravings for higher sugar foods. So those have now gone. And then at the same time, by doing the hypnotherapy, she's realized how she can also start to reprogram. And I wouldn't say, I don't know, controlling those thoughts doesn't seem right. But it's understanding where the thoughts come from. And I think it's giving you a better, when that craving is, shall we say, dampened down from healing the gut, then it's easier to acknowledge where those thoughts come from and to let them go. Should we say, that would be a better way of putting it, rather than control them, is understand that they're there, but what's driving them, and then being able to say, okay, yes, I know that's my gut bugs, but today I'm not feeding them the, sugary stuff. I'm going to feed them the good fiber so that I can help my good bugs today. So I think that's where they work, really well together, is understanding that, knowing. And I think, and I'm sure you're the same with your clients, is I think once we have the knowledge, we can then make the choices, and we understand our choices better. Mm-hmm. So if you understand food, you can read food labels. I think then it also becomes more intuitive, because you understand the labeling, and instead of just being driven by, oh, I want this, I want that, you can actually look at a label, and it's not saying, oh, this is a bad food or a good food. I think we then, by healing the gut as well, I think that intuition comes more to the fore. It becomes clearer the better our gut works. And that I find is interesting as well. So most people who heal their guts and go through the program along with the hypnotherapy, they learn to trust their gut more. They learn to listen to their bodies more. So I'm sure that you've probably found that with clients who are in a high stress environment, that they're not listening to their bodies because they're being driven by other factors. And the stress going on in their lives. And once we can start to kind of reset the gut, people then start to see their intuition coming through more, if that makes sense.
Mm-hmm. No, it does make sense to me. Yeah. So what about the other way around, or maybe that's not your clinical experience, but somebody who comes in for hypnotherapy, have you been able to, have they been able to journey all the way until it's obvious to you that their gut is fine, without necessarily you may make changes,
Yeah,
you're not actually working on from a nutritional point of view, right? Does one inform the other? In other words, can you start with the mind?
Yeah, so in my personal experience, I know that there is a lot of I'll give you a case study, and this might help, although it maybe doesn't prove the hypnotherapy only scenario. But I had a client who came to me. She was struggling with IBS and had been struggling for a long period of time. And it became clear to me when we did her intake that she was actually suffering from childhood trauma. She wasn't ready to acknowledge the trauma, and she wasn't open to doing hypnotherapy. So we started to work on her gut health. Although we didn't do the gut health program as I run it, we just started to work on some dietary changes, some lifestyle changes. She then became open to the hypnotherapy. And this is where it gets interesting, is that I guess from the nutrition point of view, there were still foods that she said she couldn't eat that were having an impact on her IBS flare-ups. Once we did the hypnotherapy, after just 2 sessions, she was eating foods that she could never have eaten before from the nutrition point of view. So I guess therein, kind of proves that yes, you can program it. And I guess it's the expectation, I think, that we can start to work with the hypnotherapy, because someone will have a food and they will have a flare up, and then the expectation is there. So for instance, someone has a slice of bread one time, and there may have been other factors going on, and they've had a reaction to the bread. And then every time they have it, that subconscious thought is there, isn't it? That this is the bread, I'm going to have a reaction to it. And then that drives the reaction automatically happening because they expect it to happen. So those are the things that we can start to change, is the expectation. But in my kind of clinical experience, yes, that works. But I think for the much longer term holistic healing, they both need to be done together to reset the microbes. It is something I'm really interested in. And one day I will find a client who is willing to kind of go down the rabbit hole and just do the hypnotherapy and see if we can reprogram the gut bugs just doing hypnotherapy. So it is something, watch the space. I might find someone who's willing to go down that rabbit hole with me, because I think our mind is incredibly powerful. And there are various things that do go on about how our mind controls the stress and everything going on in our body. So the experience is always that the gut bugs are communicating more with our brain than the other way around. But it's an interesting experiment that if anyone's willing to volunteer who listens in, I'm more than willing to go down that path.
Yeah. Well, no, it's interesting because I talked to a person I know quite well who's a hypnotherapist, and she helps a lot of people with, now I've got to say this politically correctly, it's not diet, it's like losing weight.
Yeah.
But not just, how do you say, it's not just for looks, it's health.
Yes.
It actually is getting in the way of their ability to have a full life, right?
Yes. Yeah.
So it's not just, and again, there's nothing wrong with losing weight for looks in part, but this is a more serious sort of health behind.
Yeah.
And it's very interesting. The hypnotherapy, the impact it has, because with diet, is it diet in that meaning, there are things you might want to change. If you don't change something, it's going to always be the same, right?
Yeah.
So it's a question of what came up anyways. It's a lot of saboteurs get in the way.
Yes. Yeah.
Early, voices in childhood or.
Yeah.
Manon Bolliger here, and I want to thank you for taking actionable steps towards engaging your healing journey and helping others discover their path by watching, sharing, subscribing, and reviewing these podcasts. Every review and share helps spread the word, these different perspectives and choices and options for healing. And to thank you, I'd like to invite you to sign up to my free 7-sequence email tips on health and healing for everyday life. You can go to healerscafe.com/tips. Thanks so much. Mini traumas that we experience as full traumas, have an impact on the ability to continue doing what is good for you.
Yeah.
It's like the mind catches that this is good. This makes me feel good. And
yeah.
Something comes in to knock you off, right?
Yeah. And I think, the weight loss is a very interesting one, because I've done weight loss with hypnotherapy only. And I think a lot of weight related issues are trauma related and not food related. Therefore, I think the hypnotherapy, it's one of the reasons why I qualified to do specific trauma release work with my hypnotherapy, because I think a lot of our food challenges do come from trauma and a lot of connection. So I always say to my clients, we're very, this is probably not politically correct either, but I think we're very poor at rewarding ourselves with food. And I always say to my clients, you're not a dog. Food is not your reward. We need to find other things to reward ourselves. And I think it's because, I don't know about you, but when we were children growing up, if you were sick, you were kind of given a treat almost for being, or you're sick, you know, you can have a sweet, or you've got a problem with your stomach, have like a flattened soda. You know, it's Easter time, it's sweets, it's your birthday, have a cake. And I think we do have all of these connections. And then it's almost like when you're feeling down, it's the food is the reward to almost make you feel better. And then we have that continuous of the food makes you feel better, then you gain the weight, then you have the guilt association. So I think a lot of weight is more trauma related, to be honest, than food related in my experience. So
yeah, I mean, it makes sense to me.
Yeah. And I think that's the thing, is once people learn to love themselves for themselves, then that also changes their relationship with food, and they automatically then start eating better, and it then has that knock-on effect as well. So
now, so when somebody wants to start working with you, how do, like, you know, how does that work? So that they don't know that it might be the gut, it could be their mind, it could be all of this stuff. How do you start?
Yes. So I always, I do a free 20-minute session with people. I think a lot of people are, so shall I say, unfortunately, when I get to see people, mostly they're at kind of the end of their tether. They've tried everything, nothing's worked, and they don't know where else to turn. So it's a good thing I'm there to help them and guide them, but it's also they're in that vulnerable place of this is almost like their last point. So I always like to have that conversation with someone, to make sure that I can help them and that we can work together, because we all know, you know, different people are attracted to different people, and I want them to feel comfortable with me, as well as me feeling that I can definitely help them. So I will always have a conversation with them, and then from there, I generally, depending on where they are, the program I have is healing their gut health, and their hypnotherapy is included in that program. So that's where I'll always start with someone. If I have someone who is who I can identify that there is trauma more than anything else, then I would do my trauma release protocol with them. And then I often find those people then will work with me on the nutrition side once those kind of traumas resolve themselves, and they start to, I think, feel confident in loving themselves and moving forward, and they're wanting to improve their health from the physical level as well. So yeah, so it depends on our kind of first assessment. If they specifically come to me for gut health and that's all they want, then that's absolutely fine. Or I have some people who come specifically for hypnotherapy. I do kind of, you know, do the other public speaking and all of those kinds of things as well. And sometimes people come specifically for that, and that's, you know, that's absolutely fine. But the clients who I guess I would say I'm called to help are those who need both the nutrition and kind of the trauma release and hypnotherapy. So
I noticed that you have something called Crack Your Personality Code.
Yeah.
What is that exactly?
So it's really good. It's a scientifically based assessment. And it's, so you get 4 different types of personality, which I think we all know. You know, you're either nurturing or you're very knowledge based. You're very practical. And so it just identifies your personality and also what you revert to under stress. So someone could be very nurturing, but under stress, they want to know all the facts and everything that comes up for them. So it's just a really simple and fun. It literally takes 90 seconds. And it just gives people the ability to, I think, understand themselves a little bit better, and possibly how they can communicate with other people better. And I think the reason why I like it is I find a lot of personality tests put people in a box, and sometimes they then use that box to limit themselves. So, you know, I think we see it particularly with people who are outgoing or not very outgoing, and then they're like, oh, I'm not very outgoing, I can't do that, I can't do that. And whereas this is just kind of helping you, I think, understand your personality a bit better and how you interact with other people and what interests you and how you can, I guess, kind of adapt that for people who don't think the same way that you do. So
but is it like related in that sense to the diet, how they would take on a cleansing, or those kind of programs? So
yeah, definitely. So and and then it's I guess for me it's helpful when my clients do it because I know what they need to know. So although I do a lot of things with intuition, I'm also kind of factual and science-based, and I need to know that some, kind of the supplements that I use in my program, I use them because I know that they work, and that is very important to me, to know that they're scientifically and clinically tested and how they work. So that's important to me. But some people are not that interested in it, and it just helps me understand that actually focusing on that with them is not their main point of interest when they're coming to me as a client. So from a client process, it helps me deal with them better. And I like my clients to do it just kind of like for a fun way for them. I think we also all do personality tests to see how accurate it really is. So I always say to people, just take this and let me know, how accurate you think it is. And I think, again, things can change depending on where you are in your life, your environment, your lifestyle. So it's not a set in stone, this is how you are forever. It's just how you are in that moment. So
right. Yeah.
So yeah. Yeah. And and I always say to people, we all know the more you understand yourself better, the more you can help other people, and it helps how you interact with people. And I guess for me, it also helps my clients understand what they're asking for and what they need from me as well. So
yeah, absolutely.
Yeah.
I mean, I can't believe our time is almost up. Is there any last things you want to share, or how people can find out or work with you or read, let us know what you're doing?
Yeah, so I suppose my one message to everybody, and I'm sure you do it, obviously your podcast is the Healers Café, so people know that, but I think that is the thing, is I think for people to understand that there is always hope, there is always a way to heal. It's just finding the right way for you and the right person for you to work with to help you achieve your goals and what you're looking for. Obviously, if you feel that I'm that person, that's wonderful, and reach out. As I said, I do a 20-minute consultation. Probably the best way to connect with me is on Instagram. That's probably where I hang out the most, and more than happy. And I have a book, If You Believe You Can Heal Yourself, You Can, which is on Amazon, and that's available on Kindle or in paperback, whichever way you prefer to read. So I'd say those are the best ways to kind of reach out and connect, and more than happy to have a conversation with anyone and just find out what they need and take them down that journey. Because I think that's always it. It's always about the client and what they need, what they're looking for help with, and how I can help them achieve their goals and get everybody, feeling well and feeling better and thriving. And I think that's my main thing, is I really want people to thrive and love their life and not feel like they're just surviving and getting through day by day.
Exactly. Well put. So, Kerry, have you found that working with nutrition and hypnotherapy has helped, the people, the symptomatic people that have been affected by the spike protein and the nanoparticles, and whatever else we're discovering are in these things? Is that an avenue that you think might be worth people looking into?
Yeah, definitely. So I think the one of the things is that the spike protein affects your ACE2 receptors, and those receptors are all the way in your gut lining. So by healing the gut, we're definitely making a difference. So I always say to people, if your gut lining is only one cell thick, and if you think of a spike protein, it's almost like taking I don't know, what do you call those ancient balls that had the spikes on? And I just say, if you think about that, going through a piece of thin material, that's what's happening. So as soon as we can start to repair the gut wall, then we can make a difference. And I think a lot of people are seeing that part of their challenges are gut health issues. A lot of the challenges I've seen actually are people who are having to have their gallbladders removed. And I think that comes down to the gut microbiome. A lot of our, the gallbladder supports some of the gut bacteria, and I think that is being affected. So definitely by healing the gut, it makes a difference. And I think, with hypnotherapy, as I said, the mind is so powerful. And I think people are, so we say challenged, and they feel stressed. And I think particularly with all the news then that comes along with the damage it's doing and everything else. So I think once people can understand that and feel that they can take back some control of their health, I think that definitely makes a difference. And I do have some detox protocols. Hand on heart, I couldn't scientifically swear that they're getting rid of everything, but people have seen a difference. And I think there are ways that we can definitely help, and we can support our bodies to heal. I honestly believe that our bodies are designed to heal, and as long as we can support them the best way that we can see massive improvements with our health. So yeah, definitely.
Very much, Kerry, and it was lovely to meet you and also to hear about the work you do.
Brilliant. Well, thank you so much for having me, for interviewing me, and for connecting. And I'll definitely send people to listen to the podcast, and all of the series, which is, as I said, people work with different people and feel drawn to different people, and it's, if they can find the right person who can help them, then so much the better. So
thank you for joining us at the Healers Café with Manon Bolliger. Continue your healing journey by visiting thehealerscafe.com and her website, and discover how to listen to your body and reboot for optimal health.